1 Introduction to Sociology. So, this sociology was derived from the Latin word socio means society and logos means study. So, what does the sociology means? It is the study of how the social factors such as culture, family, class, religion, how these factors will be affecting the health, illness, and healthcare delivery. So health will be there. No, it is not only determined by the biological factors, right? Social condition will be also playing an important role in causing disease, influencing treatment, and affecting recovery. So nurses must understand the social background of the patients to provide the holistic and effective care. So now we will move to the definition. So, according to authors, what are the definitions of sociology? I'll be telling. One is according to Auguste Comte, and another one is according to McClever and Page. First, according to Auguste Comte, sociology is the science of society. That means it is the study of how people live together in the groups or how they are going to live with the societies, how the societies are organized, and how the human behavior is shaped by the social relationship. According to McLever and Page, what is sociology means? It is the study of social relationship. That means these social relationships are the connections and interactions between the individuals and also this connection and interaction between the groups in the society. So sociology studies how people behave with one another, how this relationship influence the society. So next we will move to the nature of sociology. So what is this the meaning of nature means? Like characteristics or features. For example, if you are taking one person, you will tell he is short, he is having black hair, he is fair. Like that you are going to characterize or features of that person you are going to tell, right? Like that only we are going to study the nature of sociology in nursing. That is the characteristics of features. So, first characteristics or nature is scientific study. That means, as a nurses, we are using the scientific knowledge to understand the patient behavior and also to understand the community health issues. So, sociology will be using the observation, research, analysis to understand the social behavior and also the health problems. So, second nature is social science. That means it studies the human society and relationship rather than the physical objects. That means, as a nurse, we are going to interact with the patients, families, and also the communities in different social settings. So third nature is dynamic and changing. That means like technology have been improved, modernization is there. So society will be changing continuously. Why? Due to the technology or due to the culture, due to the education and modernization. So nursing care must adapt to changing the social needs and health practices. Next nature is practical and applied. That means sociology helps to solve the social problems and also it helps to solve the health related problems. So nurses apply the social knowledge in health education. They are going to apply the knowledge in community health nursing. Also they are going to apply the knowledge while providing the counseling to the patient and also in the rehabilitation. So next nature is interdisciplinary. That means sociology is not only related to one subject, right? Not only related to sociology. So it is also includes the interdisciplinary. That means sociology is related to psychology, anthropology, economics, political science, and medicine. So nursing combines this knowledge from many disciplines. Why? Because to provide a better patient care. So next nature is studies social interaction. That means it focuses on relationship among the individuals and also among the families, groups and communities. So interaction, social interactions will be there. So nurses develops the better communication and also their interpersonal skills through sociological understanding. So these are the nature of sociology. So next we will move to the scope of sociology in nursing. That means what is this scope means? Scope refers to the areas where sociology is applied in the nursing practices. So first one is understanding the patient behavior. That means it will be helping the nurses to understand the attitude of the patient towards their illness, beliefs about the treatment and also the emotional responses to the diseases. So second one is family and community health. That means it studies how the family members and also the community, how they are going to influence a person's health, how they are going to influence recovery. And next one is culture influence on health. Like different cultures will be having different beliefs, right, about either food or illness, medicine and treatment. So different cultures will be having different beliefs. So sociology helps nurses to respect these beliefs. Social determinants of health. That means factors like income or education, occupation, housing, and environment will be affecting the health. So, sociology will be explaining these effects of the health. Next one is healthcare organization. That means it helps the nurses to understand how hospitals, clinics, healthcare system will be working in the society. That is called the healthcare organization. Next one is community health nursing. Sociology will be helping the nurses to work with the communities, like community people. Why? Because to prevent the disease and also to improve the public health. And also at last, nurse patient relationship. That means good communication and understanding between the nurse and the patient, it will helps to improve the care and also it will helps to improve the trust. So sociology helps to build better relationship between the nurse and patient, so better care can be given. So next we will move to the significance of sociology. What does this significance means? It will be telling why something is important or why it matters. That is the importance of sociology in nursing. So first one is it helps to understand the human behavior. That means sociology will be helping the nurses to understand how people behave, how they are going to think, how they are going to react to the illness and treatment. So next one is promotes holistic care. That means it helps the nurses to care for the patient as a whole person, either physically, mentally, socially or emotionally. So third one is improves nurse patient relationship. That means sociology will be helping to improve the communication and trust between the nurses and also the patients, and it will be leading to the better care. And fourth one is understanding cultural differences. That means different people will be having different cultures, different beliefs, tradition. So sociology will be helping the nurse to respect these differences while giving a care. So fifth one is it will be helping the community health nursing. That means sociology will be helping the nurses to understand the community problems, to understand the health habits, and also it will be helping to prevent the diseases in the society. So next one is identification of the social factors which will be affecting the health. That means the sociology will be helping the nurses to understand how poverty, education, family, job and environment, how it will be affecting a personal health of a person. So next one is helps in solving social problems. That means it will be helping the nurses to recognize the social problems like poor hygiene and also the malnutrition, addiction and lack of health care. So we are going to find the ways to help the people. So next one is it enhances the communication skills. That means it will be helping to improve the communication skills mainly between the nurses, patients, families and also the communities. Next we will move to the supports health education. That means it will help the nurses to teach the people about the cleanliness, about the nutrition, about the disease prevention and also about the healthy lifestyles. And also it will be helping to develop professional skills. 10th one. So what is this professional skills means? Like it will be helping the nurses to develop the qualities like teamwork, leadership, empathy, patience and decision making skills. So these are the significance, these are the importance of the sociology in nursing. So far we have studied about the meaning of sociology, nature of sociology, scope of sociology and significance of sociology. Thank you.